Hello everybody. Today I'm going to talk to you about what can you do in women's health after pursuing an MD in preventive health and family medicine. So that's a question one of the channel viewers asked about what are the various options one can find, or how do you really engage and work in the women's health segment. Firstly, I would like to point out on the aspect of preventive health. So preventive women's health, I think, is a very critical subject which we all need to focus on. Right from the menarche to menopause, the conversations around preventive health has been very minimal. So amplifying this and mainstreaming this is useful in strengthening knowledge literacy and community-based awareness in the women's health space. The next thing we need to focus on is on the reproductive health and also the sexual health and contraception. A lot of women today, depending on the available information, available knowledge, access to healthcare, and access to, more importantly, affordable healthcare, have different views and opinions about what are the choices available pertaining to sexual health and contraception. So clearing myths around this, teaching them the right available options, particularly in the rural spaces, becomes integral into building and strengthening healthcare access delivery for women around rural communities. The next thing that can be focused on is the core issue of maternal mortality, maternal anemia, and core grassroots concerns which have been plaguing a lot of low and middle income countries for many decades now. This does not require great global health funding, but it requires sustainable commitment in that space. And I think there's great opportunity to tap in those segments. A more important and perhaps social ill of our times is the consumption and increased consumption of alcohol, particularly among teenage and young women. The conversations around how alcohol, smoking, and also drugs interferes with the hormonal balance, interferes with the reproductive system, and also disrupts the gut-brain metabolism, the gut-brain barrier, needs to be taken to different places, to different communities, to different citizens across, so that they understand the nuances that this brings into how women's health can get shaped up, particularly when it comes to women in the reproductive age group and of child-rearing age. Lastly, we can also look at how artificial intelligence can influence early detection of cancers, detection of mental health issues such as depression, anxiety disorders, how artificial intelligence can play a very critical role in early detection and screening and treatment, thereby improving and enhancing women's health, which has often been a neglected priority over the years. So, put together in these ways, I think those of you who want to focus on women's health after your MD community health or MD in preventive and family medicine have a wide area of option, which probably I would put it as is a life's work. So there's a lot to do. Don't just depend on funding, but probably just start off. Funding will follow. Work with integrity and honor, and you will succeed. Thank you very much.